You know what needs to change. You know what's wrong. We gotta treat people the same. We gotta get along. Do you know the history of the country where you stand? Do you know how they treated the first people of the land? Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Come back, we can rewrite.
Good morning, everybody. My name's Walbira Murray. I'm a Gomeroi woman from Queensland working with AMSANT and Sheree Cairney.
I'm Sheree Cairney.
We're doing the non-clinical indicators measuring beyond medicine study with AMSANT. So this is our research question, and why it's important. I'm going to share a little very short yarn with you. I was in an Aboriginal health service and I witnessed an old lady saying to the non-Aboriginal nurse, "This is my country." And the nurse kept on arguing back with her going, "This is my country too." And the old lady got more and more agitated, and it made me wonder how safe she was going to feel in discussing her health with that nurse later. And for me, it really indicates how important measuring the non-clinical indicators are.
So our research question there is, does measuring non-clinical indicators add value to CQI in Aboriginal primary healthcare in the Northern Territory? Why do we care about indicators? This quote describes this well. Indicators are a way of seeing the big picture by looking at a small part of it. So we're all familiar with those terms, KPIs and CQI, and so they're all based on measures, and it's very important and easy to measure clinical indicators, so things like blood pressure, taking blood tests, etc. But in the non-clinical area of things, it's much harder to measure these things, and is one of the reasons, I suppose, that they kind of get left behind. And so we're looking at measuring things that are hard to measure, and we won't get it right, but it's important to begin the process so that we can begin to value them. And there's a quote, what gets measured gets managed, and so when things are not measured and acknowledged, then they're not understood. So if we're talking about something like cultural safety, for example, a scenario is, what if our funding in the health systems was based on performance in cultural safety? If we had a good way to measure that and we begun to fund the services that were delivering culturally safe services, then we get a really different picture. So this particular project has come from, there's been a couple of decades of AMSANT and members advocating for the importance of measuring the non-clinical indicators, because these are the things that are important to the health services in Aboriginal primary healthcare in the Northern Territory.
So why non-clinical indicators? As you can see up there, at the moment we're only measuring the clinical, and it's only getting that much of the story. Aboriginal health and Aboriginal people were holistic. By missing out almost in 1/6 parts of that, we're not getting the full story, and we need it in order to close that gap. So this is our governance and our team and partners. Really important, everybody is equal in this process, as it is a holistic process. They're the key players, and this is being driven by all of these different areas over the last decade. The NT Aboriginal Health Forum in particular, and our ACHO members of AMSANT have been really strongly requesting that this work be done. So it's exciting working with them, and they're all in having equal partnership and voices in this process.
So in terms of where we're conducting this research, initially the goal was to actually just work at one member service, being Congress, and then we quickly realised that getting data from one place wasn't going to be able to tell us much about how indicators might work in different places. So we've thrown the net wide, thought big, and had a look at all of the clinics in the Northern Territory, all of the community controlled and also the NT Gov clinics in the top end and Central Australia. So we've been going through a laborious ethics and approval process, as most of you would understand how that goes. And so we've gotten approval just recently to do this research at the NT government clinics in the top end and Central Australia, and through the ethics committees in both those places, as well as beginning to get individual approvals from each of the clinics individually. So it's looking good. We're willing to actually be able to conduct those in those places So this is just a bit of a flow chart of the thinking behind developing this. So the initial step is to have a look at, what's out there that can inform this process or that we can build from. And so we've looked at these sort of, on the left here in the green, the three different sort of lines of sources of information, looking at the literature, the academic and the grey literature, look at existing knowledge. This one is looking at academic and grey literature, looking at frameworks. There's a core services framework that was a piece of work that was carried out in 2011 that formed the basis of this project. And in that, some of you might be familiar with that, and in that there was 5 domains, and clinical was only one of those domains. And so the NT KPIs and the national KPIs are really focused on those clinical ones. Workforce is one of those indicators in the non-clinical areas that's probably had one of the most attention, but the other areas are health promotion, corporate services, research, policy, advocacy and planning, and cultural safety, community engagement and community control. And so we've started looking at those from the core services framework, and then also have a look at other frameworks that are being rolled out across the country and globally around these areas. We've also looked at the values of AMSANT and the members and of Aboriginal primary healthcare, and also drawing on the expertise of our chief investigators who've got expertise in various areas that are important to the project, as well as the Aboriginal Advisory Group, and working under the NT Aboriginal Health Forum and the AMSAT member board. So from this process, we're looking at all the frameworks and domains and indicators that are in this space that are relevant. And from that, we're sort of finding there's a lot of frameworks, there's not many indicators. But once we get that shortlist, which we're in the process of now, we'll submit that to a Delphi or a consensus process to have a look at those that are working in the field that will use the tool and who it's relevant to get feedback on to narrow it down. And then we'll look at piloting at 2 to 3 sites initially and then NT-wide. And when we get that data, we'll have a look at the validity, the reliability and the feasibility. And then we'll look at how we can, in the timeframe of this research project, how we can set that knowledge up so that it can best be translated beyond the life of the project. So just a little summary of how the lit review, first of all, for example, on the left is just to kind of have a look at how this stuff gets narrowed down. We've taken a structured lit review approach to have a look at what's out there. And so, for example, looking at search terms like Aboriginal or Indigenous or First Nations, we get 182,000 items, and then narrowing that down to and indicators. We get a lot of clinical as well as land management and different areas like that. Some of them are relevant actually and some might not be. So, for example, cultural safety is relevant in all of those. And looking at health and health services. So narrowing these down, this is a bit of a process, but then there's also a bit of a flow on of having a look at, grey literature or things that have come off bodies of work that, are relevant, and then compiling those together. And the screening process involves including those that are non-clinical, so it's removing those that are clinical, looking at those that are relevant for the health services and relevant to all of our domains. And removing those, there's a lot around personal wellbeing, and these are not relevant here. So personal wellbeing measures are often, say, self-reports or different things about individuals. And so the window that we're looking, I guess, is non-clinical, but also related to the health services. So that sort of removes a lot of self-report and subjective measures as well. So that's sort of narrowed it down to about 10, which is even less when you actually look at those that are relevant here.
I've been doing a lot of the framework review, and we found 42 relevant frameworks. Only 27 of those had indicators, and not surprisingly, most of them don't have, the ones we're most interested in don't have the indicators. And that's why we're doing the work, we recognise that. And in clinics, blood pressure and diabetes checks take precedence over cultural safety, but cultural safety will improve blood pressure and diabetes and other health outcomes for Aboriginal people. I was in hospital, and the lady in the bed beside me had had her leg amputated in Adelaide and had come back here, a community woman, and she was really agitated. She needed to go outside. She'd been locked in a hospital room for weeks, and she wanted to go outside because that's where you see other mob and you might see family and all of that. And she kept on asking the nurse to go outside, and the nurse kept on telling her no, not until her blood pressure came down. And she got more and more agitated, and I said to the nurse, if you let her go outside, her blood pressure will come down. Who are you? You're not a health worker. I know what I'm doing. And when I left, that old lady was still in that bed and hadn't moved. I guess it's one of the reasons I'm passionate about this work.
The next steps really that we're looking at is finalising our indicator list, submitting it to that expert review process, and then looking at piloting it. And so I guess the uptake of this work depends on as many relevant players in the mix being aware of it, promoting it and coming in and letting us know what you do. So we'd love to hear from anybody who's working in that space and is interested in this.
To go, the intervention as a whole, stop controlling my peace.